patients who develop testicular cancer tend to fall into two groups initially. Those where we believe the cancer is confined to the testicle. They will have had surgery to remove that testicle or part of the testicle. And those patients will often be offered or the choice or advised to either be watched or to have some additional treatment to reduce the risk of recurrence. That's a big discussion and is an area where there are very diverging opinions. The other group of patients are those where they've already completed chemotherapy for testicular cancer that has spread and the cancer returns. Now, we know over the last probably 20 or so years that we can group patients into their relative risk of the cancer returning. A lot of that risk is related to how advanced the cancer was in the beginning. Those patients where the diseases spread to lots of different areas, in particular those where the disease has spread to the liver or the brain or the bones, those patients tend to be at much higher risk of recurrence.
Testicular cancer will often reoccur within 2 years after initial treatment, and around about 5% of cases will occur after that. Men who've had testicular cancer will be followed up in clinic with various blood tests such as tumour markers and CT scans for a good 5 years, if not 10. And any reoccurrence can usually be detected by rising tumour markers such as BHCG, LDH or AFP.
If people develop a cancer again after treatment, they're two different situations. We're talking about people who develop recurrent testicular cancer, which is probably their highest risk. But there is also the question of whether these patients are more likely to get another cancer. And we know they are. Having one cancer puts you at higher risk of developing a subsequent one. We also know that unfortunately most chemotherapy, particularly some of the core drugs that are used for testicular cancer, do increase the risk of other cancers. That's why there's been an attempt to minimize the amount of treatment people are having, particularly if we expect that treatment to be successful.
I mean, there's always the worry that men who've had testicular cancer, that it can come back, but the important message to remember is that if it does come back, then there is a very good chance it will be cured. It will require more intensive treatment and perhaps more intensive chemotherapy, but at the end of the day we know that most men in that situation can be cured.